least 10 million people get gallbladder stones in India every year, but there's a lot of misinformation about this disease. There are lots of myths that go around, and today we are there to clear them. I'm with Dr. Pradeep Chaube, who is a laparoscopic surgeon, and he's the chairman of the laparoscopic department at Max Super Speciality Hospital. So Dr. Chaube, just tell me, how common are gallbladder stones in India and who is at risk?
Gallbladder stone disease is a very common disease, and about 40% patients are male patients and about 60% patients are female patients. And generally it affects 20s, 30s and 40s decades of life, but it's not rare to see gallstones in children and senior age group as well.
So does it run in families? Is there a genetic predisposition?
We have observed this, that a lot of family members may have gallstone, but there is no genetic coding for a gallbladder stone.
So what are the symptoms, and does everyone get symptoms?
Symptoms are seen only in about 40% patients who develop severe upper right abdominal pain, which may need injectables or emergency room management. But 60% patients will not develop symptoms, and we feel that lucky person develop symptoms because it is diagnosed and treated, and some unfortunate patients may not even know that they have got a gallbladder stone.
So then it becomes like a silent disease, and the only way it can be screened is if you go for your annual checkup. Is that it?
Yeah, I think that is why the annual checkup becomes important, what we call as a preventive health checkup, PHPs.
How long does it take for gallbladder stones to become big enough to become an irritant or for them to start affecting the organs?
Gallbladder stone, from the time it is formed till the last day, it is dangerous. And I will explain you why.
So the size doesn't matter here.
Size doesn't matter here,
Okay.
because this is one disease. Because if their stones are very small, they will slip from the gallbladder, go into the common bile duct and block the pancreas and block the liver, causing jaundice and pancreatitis, and it's a very serious matter. Or they may get impacted at the neck of the gallbladder and produce pus in the gallbladder, what we call empyema. Sometimes it perforates also the gallbladder with overdistension. When after some time these stones start getting together and forming a bigger stone, and this stone continues to increase in size, and all our textbooks mention that if the stone is 3 centimeter or above 3 centimeter, it is a precancerous condition.
Why does it happen? Again, is it lifestyle or is it partly genetic?
Well, I think part of it may be lifestyle, because we see it more in affluent families and affluent class of people. It does not mean that the labor class doesn't get it. Even the poor people, labor class, manual workers also get it, but the proportion is less. That indicates indirectly that probably a fat-rich, cholesterol-rich food with a little sedentary life may be one of the responsible factors.
So does obesity also have a role to play?
Obesity plays a huge role. So the patients who are overweight or obese are likely to have much more chances of developing gallbladder stone than the normal weighing person.
And what about preventive measures? Are there things people can do to ensure that they don't get gallbladder stones?
Well, I think in a true sense there is no prevention. Maybe I can just say that their weight, when they are managing their weight, I think they should avoid a gross weight loss or like the weight loss,
Crash dieting should be
crash
avoided.
dieting and unsupervised, because that can precipitate and cause gallbladder stone. Second situation is of course the obesity. If they keep their weight under control, I can think of these two common conditions which can can be called as a preventive method.
So do people who undergo bariatric surgery, let's say, would they be at risk because they lose a lot of weight suddenly?
Yeah, definitely the patients who are operated for weight loss surgeries, we put them on anti-cholestatic drug for 6 months, because 6 months is the time when they lose weight rapidly, and that we prevent that by giving them anti-static. There are drugs like Udiliv, etc., which can prevent such situations.
So there are also lots of myths about gallbladder stones and how they are formed. People think eating supari or pan masala increases risk. They think spicy food increases risk. They think eating tomatoes and chickpeas and rajma, lentils increases. So is there any truth in it?
There is no truth, as I would like to mention that gallbladder disease is very poorly understood disease, even in the medical professions. No diet as such is really responsible for causing gallbladder stone.
So endoscopic surgery has really transformed treatment of gallbladder stones because our patients walk away in a day and you recover very quickly.
Yeah.
So just tell us something about it. How safe is it? Are there any side effects? Can people go back to their normal life, go back to normal food after surgery?
Yeah. See, endoscopic surgery actually became popular because of gallbladder stone. Sometimes it is called as the kindest cuts of the surgeons, because the surgeon's cut cannot be kind. So laparoscopy made whole lot of difference.
So it's a super safe surgery.
It's super safe surgery, and of course it goes for any surgery. The person has to be trained, the equipment should be there because it's a high-tech surgery. So you need a high-tech.
You need to choose your surgeon well.
You need to choose the surgeon, the institution where can have a good high technology, high-end gadgets. And today we are talking about micro laparoscopy. That means that instead of using 10 millimeter and 15 millimeter punctures, we are using 2 millimeter and 5 millimeter punctures. So the punctures are, as big or as small as the pricking of the ear lobule.
So it's almost like you're going home with a band-aid over your
Yeah, I
abdomen.
think most of our patients, we admit them in the morning, and the surgery in expert hands may take maybe 20 minutes, 25 minutes, and the anesthesia which we are using is a ultra short acting anesthesia, which is monitored by the computer and of course the anesthetist, and these patients are up and about very quickly, and with such a tiny punctures is a little discomfort which also disappears when they start walking, and they can resume practically the normal work within hours after the operation, and there are no physical restriction or dietary restriction from next day.
So there are no dietary restrictions, but you would still advise people to have as healthy a diet as possible.
Yeah, other dietary restrictions which are for general health, like low fat and this and that, I think that continues. So no specific restriction after the gallbladder has been removed.
So if your gallbladder stones are undiagnosed, what is the risk for the patient?
Apart from pain, abdomen, which we as a surgeon we feel that is a very simple.
But you said
to
a
treat.
lot of people don't have pain.
Yeah. So problem arises in those 60% patients where they know that their gallbladder stone is diagnosed and they are waiting for the complications to come in. For example, biliary pancreatitis is reasonably common, and the stones coming down and causing jaundice. Now biliary pancreatitis has got mortality of 20%. Complications like pancreatitis, jaundice, long term sometimes there is a impaction at the neck and the gallbladder perforates also. Then there is a vascularity is compromised. Then there is a gangrene of the gallbladder. So there is a n number of risks.
But do you get complicated cases, or do most patients at least come here in time?
I think what we advise is the prevention. So it's a preventive health checkup. So once a gallbladder stone is diagnosed, it should be addressed and it should be operated and should be removed and should be biopsied. So this will prevent the complications like pancreatitis and gangrene and cancer of the gallbladder can be prevented.
One of the myths is that even if you have a gallbladder stone, if it's not bothering you, you can leave it alone. If it's not causing pain, you leave it alone. So clearly that's not the case.
That's absolutely not the case. It's other way around. The moment you get a gallbladder stone diagnosed, that is the best period, and I call it as a golden period of a disease. For that matter, any disease. So what is a golden period of a disease? First, it should be diagnosed. Second, it should not have caused symptoms. And third, it should not have created complications. So when in a preventive health checkup we get gallbladder stones diagnosed, that is in the golden period of a disease. So diagnosis is there, the treatment options are available and the cure is available. So that is the time when we should consider surgical consultation and operation.
Thank you so much, Dr. Chaubey. That was really useful information. I hope that cleared some of your doubts about the gallbladder disease. Thank you so much.
Thank you.